Welcome to my pictorial review of my recovery from double jaw advancement surgery to correct sleep apnea that occurred on March 29th, 2017. After about 10 years of treatment for sleep apnea, I opted for the most invasive surgery possible, which was the double jaw advancement surgery. Had success for about 5 years with a dental appliance that I wore while I slept. After a sleep study that pulled my jaw forward while I slept and kept my airway open. That result, though, was that over time I had to continue to crank the device forward, which impacted the joints in my jaw and changed my bite. That then resulted in me getting braces. And as I had braces, I also had a septoplasty and turbinate reduction to repair a fractured nose and deviated septum that was a result of a soccer injury probably about 10 years ago, and that did not affect the sleep apnea nearly as much. So as the orthodontia took place and took hold and was effective at realigning my bite, the sleep apnea returned. I sought out a top ear, nose, and throat specialist who was doing work with the Inspire device, which is an implantable pacemaker type device that you wear or that is implanted inside your chest, and it provides a mild stimulation to the nerves and the muscles in your throat while you sleep and keeps your airway open. I was referred to them as a candidate because of my age, fitness level, and overall health. Not overweight and a non-smoker. However, Moore's Law has not yet impacted the Inspire device, which means that it is still not smaller, cheaper, faster, with more functionality. So the current version at the time had a 10-year lifespan on the battery. So at 48 years old, I was looking at, or 47 at the time, potentially 4 times getting the device put in my body. And if I lived to be 40 more years old, then decided, nope, not going to happen. Also was not compatible with an MRI, and I've had multiple MRIs, have had knee surgeries, elbow surgery, hand surgery, and a number of other surgeries and injuries from sports that required MRI, and the thought was that at my activity level, the chances of me not needing another MRI were perfectly slim, so we chose for the double jaw advancement surgery after a sleep endoscopy revealed a complete closure of my throat as I slept. To the tune of about 20 times per hour, which really reduced the oxygen that I was receiving as I slept and was causing some potential health risks long term, as well as a really crappy quality of life. Upper left corner is the day that I returned home from surgery after 1 day in ICU. It was an 8-hour procedure. I have a jaw bra on my face to keep my face tight. It's very tight compression sleeve. Hold everything in place and try to get the inflammation out, and then you can see there were ice packs on both sides of my face. The picture beside it on the right is 3 months following surgery. Looks like my jaw is going back to normal, and it was the day that I got my braces off. Bottom left is the day following a complete nasal reconstruction and rib graft from my own rib. Was a result of a complication from the surgery when they extubated me. Upon the removal of the tube, they did not, I guess, realize that my septum was detached and then reattached with a couple of stitches, so my septal bridge completely collapsed inside my nose, and I then had to kind of allow that to heal for 3 months before I could get that repaired. The bottom right is 1 month following. You can see the tip of my nose is still quite inflamed, and it will be so for probably 12 to 18 more months, but I do look much closer to I looked prior to the surgery in the first place. First picture is the before, the day before, in fact. One was in my car and one was at my desk in my office, just to show what I looked like prior to the surgery. You can see what I looked like there. This is the pre-op x-rays that shows just the wire from the braces at the time, ceramics, so you can't really see a lot of the metal in my around the teeth. Post-op x-rays, 6 plates, 36 screws. They removed my upper jaw through my upper lip, and they did some side holes on the sides of my jaw to remove my lower jaw and then reattach everything with plates and screws. Again, 6 plates and 36 screws to put my face back together. Here is a before-after, pre-op and post-op. You can see the jaw and the nose profile change quite a bit as it was pulled forward. Of course, the septal collapse had an impact on the nose appearance as well. Here's a frontal view, panoramic view of the same, the plates and the screws, and you can see that I have surgical hooks on the braces. Those were just used to keep my jaw wired shut during the surgery. They were not permanent, but the hooks were placed so that they could wire it shut so they could move the entire jaw in one piece. Here is the airway. This is it. This is what they accomplished. If you can see, I have the size of about a straw or a pencil on my airway normally, and that is standing upright. The after photo shows how much larger the airway has become, which then when I sleep does not close and has made a significant impact to the quality of life because of it. Here I am the morning after, post-op, at home. You can see my nose does not look right and it's bleeding. My face is completely swollen here and pretty scary looking. That's later in the day. I couldn't open or close my mouth anymore. You can see the drool coming out. That was awesome. I looked and felt like I got hit by a truck because I did practically and was not expecting at all the type of pain and discomfort that I would feel that I felt in that spot. Here I am a couple of days later. I think the surgery was a Wednesday or a Thursday. I think a Wednesday, and here I am the following Monday. You can see I started doing a front, left, and right side. You can see on my cheek rather, there is a little scar that shows where they did like a sort of an arthroscopic or laparoscopic insertion of a scope. I poked a hole, stuck the scope in, blew my face up, all that stuff. You can see some bruising along my neck and along my cheek. Here we are a week later, lots of bruising as the swelling goes down sort of my face and into my neck. This is in the waiting room 1 week following the surgery. The chief resident was absolutely shocked, said that I looked like I should look after 1 month, and said I'm probably in the top 1% of all patients for recovery. And I believe that had to do with the fact that I followed every specific instruction possible. And while on a liquid diet, I had the most healthy diet you could imagine. And I followed every single instruction around how to eat, the medications, icing, all of that, and said that I'm recovering faster than most of their patients. It's also where I learned that the septal issue that was created in my nose and sinuses was a process of 3 months. There was nothing they could do except for to wait and see how it healed. And in 3 months' time, I would know what my options are. Here I am a couple of days later. You can see the inflammation is going down. The bruising is moving down to my neck, which just means that the blood is going through my body and gravity is helping to get the inflammation out of there. Again, a front, side, and two-side view to show the progress over another week. Here I am a couple of days later. Again, now the bruising is becoming more yellow as the blood and the body pushes it out through lots of hydration in the liquid diet. Here I am 2 weeks post-op. You can see I have a bandana around my neck, and that is because I have no feeling in my upper lip or my lower lip at the time. I'm on a liquid diet without a straw, so I'm just drinking and sipping and trying to use a syringe. So I drip a lot of food down the front of my face, and I use that bandana to help with that, as well as to stop the saliva when I tend to slobber, because that's a big issue. Here I am 2 weeks post-op. I've got the bandana again in full effect. The inflammation is going way down. I think the biggest thing is if it weren't for my nose, I would look a lot closer to normal. And again, in 2 weeks, when I went to the appointment, there was again a lot of pleasure from the doctor in terms of how my recovery was progressing. Here I am on my son's 16th birthday. Just about to go out. Took another couple pictures. You can see that my jaw inflammation is going down. I still look like I'm probably 10 or 15 pounds overweight, but that's just the inflammation. You can see my upper lip is really kind of the one that's more swollen, and that is because I have had an incision that went the length of my upper jaw, probably across 10 teeth, and that's where they did the upper jaw surgery and installed some plates into my face. Here I am 3 weeks out. That's the best smile I can muster. There's a lot of stuff going on in my upper sinuses and my deviated septum, which really kind of created a cloggy, like more of a kind of a confined environment, and without having muscle control or nerve feeling, it was difficult to muster a smile that didn't look forced. So that was about as good as I could get. Here I am a couple weeks later. You can see my nose running on the right without the septum. I did have a kind of non-functioning nose at the time, but again, the inflammation and now the bruising is almost completely gone, if not completely gone. Here I am before the surgery and then 1 month following. If not for my nose, again, it doesn't look too bad. But again, I just look in the face like I'm overweight. But the nose is something that's very, very noticeable, and I think caught most people's eye when they saw me in public. Here I am 1 month out, and it was it was at the end of a day coaching soccer at a college showcase, and you can see my face is leaning out quite a bit. Actually, very good therapy is to talk and to project your voice, and so I coached a couple of games, and that really did help with the recovery. So that day I actually looked pretty good because a lot of the inflammation was gone because it worked its way out as I spoke. Here I am 5.5 weeks out. You can see some of the inflammation is out because depending on what time of day I took these photos, it could have been in the morning. I'm a little bit more inflamed in the morning. 6 weeks, no bruising, just inflammation. 2 months, just shy. You can definitely see the nose looks different, but the jawline is looking pretty good. Here I am 2 months and a week. Again, slimming down of the face, and again, only the nose is really what looks a lot different. Here I am the day I got my braces off, 3 months and 1 week. You can really see on the right side picture the nose kind of jetting out and the bridge kind of collapsed, and that's because of the position of the septum. But I think I passed to go out in public in this picture. Here I am trying to update my LinkedIn profile pic. Again, the smile is as good as I can do because I do look a little bit disfigured when I try to smile, and it's kind of interesting, but that's not bad. I can take it. Here I am a week before the surgery. You can see the broadness of my nose. That was on vacation a week prior to the nasal reconstruction. Reason for the nasal reconstruction is because when I went back to the ear, nose, and throat specialist to evaluate the septal displacement, it was determined because it was now 2 nasal surgeries effectively. I had no functioning nose. It was a complete septal collapse and nasal deformity. First ear, nose, and throat specialist referred me to a plastic surgeon who was an ear, nose, and throat guy, who then said it was still too big of a job for him. So I ended up going to a plastic surgeon that specializes in trauma patients, gunshot victims, cocaine addicts with no septum, car accident victims. So this was a nasal reconstruction with rib graft. So they cut right through my abdomen wall, which pissed me off, to extract some cartilage and some bone from my ribs to rebuild the inside of my nose. And so this was the day after surgery. During the surgery, my jaw surgeon removed 2 of the plates and about 10 of the screws from around my sinuses to give me some additional relief. So let's hope that it helps. Although as of this recording, which is about a month and a half from the nasal surgery, I still sound a bit nasally because of the inflammation. Here I am a couple of weeks out. You can see there's still some bruising under my eyes. You can see some crusting and blood under my nose, and you can see the tip of my nose is still pretty inflamed, and it will be for about 18 months, or 12 to 18 months. Here I am again on a week later. You can still see the tip of the nose is still projected, but it looks like I'm going to have a much better profile as well as front on view as a result of hopefully a very effective nasal surgery. Then the following picture is just another week out. You can see that the inflammation goes down a little bit every week or every day. And here we are 6 months post-jaw operation, 6 weeks, 5 weeks from actually 23 days, 3 weeks from the nasal reconstruction surgery. And then here we are on almost 6 months and a month after the jaw, which is the before the jaw, the before the nose, and the after both. So thanks for watching the video. You'll see many more of these where I'm actually going to chronicle the impact that it had on my day-to-day life, how I was feeling that day, the effects it had as someone who speaks and presents for a living, and someone who, both in the professional workplace by being a software sales executive to enterprises, as well as running and coaching a soccer club, and coaching clinics and coaching teams. My face and my voice are my tools, and so you'll see throughout these video clips how I was progressing and what I was experiencing. So my guidance to you, if you're going through this surgery yourself, is to look at what people are saying out there. There's a tremendous amount of video updates on mostly what people are experiencing for that first month, with the diet, with the liquid diet, with the syringe and things like that. For me, this is more about sort of the longer term recovery, what my physical appearance looked like and how I was feeling and how that was impacting my day-to-day life. So thanks for watching this one. I hope you enjoy the others, and check out my channel and continue to watch the updated videos as they come out. And thanks again for tuning in. Have a good one.